Hello, welcome to Lisbon in Portugal. I'm Rui Martins, Head of Communications from Dianova, Portugal, an NGO working in the field of drug addictions, from prevention to treatment to social reintegration. It means that people can have a small amount of drugs, usually for instance cannabis, for a short period of time. I believe the law says up to 10 days maximum. And what it brought to this specific target, and then also for the adults target, was a more integrated approach treating drug addicts or heavy consumers on a recreational basis on a health promotion oriented approach. It brought them more to the treatment programs instead of going to prison, making a decrease on the number of inmates and the related social costs, even direct and indirect costs of imprisonment in Portugal. So one of the things that we are trying to see is if from decriminalization we should go, for instance, for the legalization in order to reduce some of the negative aspects that still are facing, especially the youth. It might help, we don't know, because the experience is like in some states of the US and now Uruguay in the past 3 months. It's too early. We don't have a follow-up study in order to see the impact on the economic aspect, on the taxes that the government says that will bring. The municipality of Lisbon is discussing in these past 2 months if they should implement this program or not. But it's still and always on discussion, on debate. It still doesn't exist the possibility of being a heroin user and being provided the heroin on a controlled environment to reduce the harm effects of the needles, sharing, etc., etc., etc. Yeah. The decriminalization policy has been quite positive, I would say, even with the negative aspects that still are to be improved over time. 80% is very positive under this policy. So I would suggest for other countries like US or others that are still focused on the criminalization of the drug users, in order to start to see the potential benefits and the positive aspects of the decriminalization policy in order to decrease the social and healthcare costs of these huge multi-million or multi-trillion, as you say in the US, business. On an overall perspective, the decriminalization policy has been quite positive on all aspects.